My name is Erin Colburn, and I'm doing this media project on what is an education specialist for my health education course at Boise State University. It's in my experience as an academic advisor in the health fields that students are often asking me, well, what is a health education specialist and what do they do? Where do they work? What information might I need to know to be able to become one? And I felt that this quote that was presented in our textbook by John Allegrante was very valuable to those comments or those questions. He indicates that he's always believed that the goal of health education is to promote, maintain, and improve individual and community health through the educational process. So for the purpose of this media project, we're going to talk about what a health education specialist does, where they might work, when they work, education and training, and pros and cons of the field, and talk about a little bit more of the summary of the position. So what do they do? They are assessors. They work to assess health needs in the community and with individuals. They develop programs and provide teaching materials. They also teach people and manage health with existing conditions. They evaluate effective programs or ineffective programs. They help people in health services and information, provide training. They implement programs, advocate for individuals, whether it might be for policy or social justice, and they collect and analyze data. Their work environment can be pretty broad. They can work in individual and family services, whether that might be counseling or women and infants and children. They can work in policy for an organization like the CDC or the Public Health Service. And they can work for nonprofit organizations like the American Cancer Society or Susan B. Komen. They can also work more structured in hospitals, outpatient care centers, and school health or university settings. Whether you're working with a professional style in a state institution or a private institution, health educators are professionals. They're typically salaried, and then that would mean that the work would need to get done within a work week, but it could be 50 hours or it could be 40 hours. And in some cases with state or localities, an individual might be what we call classified employee, and therefore would work in more 8 to 5, Monday through Friday, and would be paid for overtime. Education and training, which is an important component of our course. Health educators typically have a bachelor's degree in either health education or health science areas, and this bachelor's degree usually includes an internship. If they don't have an educational background in the health education area, they might choose a master's degree in public health, and even those who have a bachelor's degree in health education that want to further their careers would have benefit in one of the MPH programs. Community health workers are a specialized area within health educators. They might be doing a lot of the work that a health educator is promoting or implementing. They typically might need just a high school diploma, and some of the jobs do require some post-secondary education, maybe even 1-year certificate program. Possible certifications and organizational memberships that a health education specialist might want to be a part of. More specifically to the certifications would be the Certified Health Education Specialist, the CHES, and the Master CHES. These are exams that would exemplify the core competencies that a health education specialist would need to know. Organizations that they should also consider being part of are SOPHI, the ACHA, American College Health Association, and the APHA, the American Public Health Association, to name a few. The job outlook for this position as a health educator and community health worker is a 16% growth from 2016 to 2026, which is much faster than the average for most occupations. Pay, in terms of a median, is about $38,000, with the lowest 10% being about $25,000 and the highest 10% being $64,000. There are some pros and cons for this position. Pros might be for a health educator that could have health work-life balance and the feeling of being of service to others, working benefits themselves and their community. There can be some cons. Those might be lack of resources or a political agenda that might get in the way. And it's often difficult to get into this area of employment without experience. So as a whole, what I've discovered about a health educator is that they're promoters, that they advocate, that they assess. They do have a pretty good job outlook. They have a pretty good pay. They also have a lot of organizations they can be a part of that implement their abilities. Thank you for your time.